Florida Alliance for Retired Americans annual Medicare and health care event that we have each year. We've been having them here. Our host club has been very great in doing turnout. Our Delray Beach chapter of the Alliance for Retired Americans, Sid Bifkowski. Let's give Sid and his club a good round of applause. Local area celebrities that are referred to as the Raging Grannies.
This is old gray granny, ain't what she used to be. Had a hysterectomy, needs a colonoscopy, but she can't afford to pay for her care, and so I guess we'll have to shoot her.
I'm proud to have the Regional Director for the Human Health Services section of the Obama administration with us today to enlighten us on the Affordable Care Act, as some of the dastardly population referred to as the Obama bill. Well, we're proud of the Obama bill, but the name of it is the Affordable Care Act, and it's about people. It's not about politics.
You've probably heard, I've heard a lot about the Affordable Care Act, and you know what you want to know about it. So I want to give you kind of a big picture of some of the things about the Affordable Care Act and some of the important things that we're doing right now to try to continue to improve healthcare and make sure that it's accessible, affordable for all Americans, regardless of who you are in this country. People don't realize is that the Affordable Care Act is not just about helping you to get care or access care when you're sick, but a big piece of it is figuring out how can we continue to innovate in healthcare. And we know that we want people to live longer, better, healthier lives. We got to continue to find ways to make sure that they can get better faster, that we can cure diseases and cure illnesses. Well, in the state of Florida, we're investing in groundbreaking biomedical research that's focused on trying to find cures for various cancers. And we call these the Therapeutic Research Discovery Project Tax Credit Program. That means there are some private businesses right here in the state of Florida who are doing groundbreaking biomedical research. And we continue by giving them tax credits and giving them grants so they can keep doing that research to find cures for cancer and all kinds of other things. And in the state of Florida, $26.2 million went to research firms here in the state. Some were at universities, but most of them were in private businesses. They were able to hire people to help them to give into the state of Florida around helping the state to have more oversight over insurance premium increases. Because again, we all, if you've ever bought insurance in the private market, you know at any given time, your premium could go up 20% a year, 18% a year, 5% a year, 10% a year. You never knew why it was going up. You didn't know it was going up because everybody in your group maybe used services, or maybe it just went up because they wanted to put more money into marketing or put more money into executive compensation. Well, we didn't have any clue as to why. So we made available in the Affordable Care Act $1 million grant to every state that wanted it, so they could hire staff to do insurance increase reviews to make sure that these premiums are going up for real reasons and not going up for frivolous or arbitrary reasons that wasn't providing care or services to people. Well, that's the $1 million that the state of Florida gave back.
In honor of your outstanding leadership to protect and preserve Medicare, the Florida Alliance for Retired Americans proudly presents Senator Bill Nelson with this award of excellence. Congressman Alcee Hastings, we have one of his staff people here. Yes, come on up. And all the game playing going on. It's a hard fight on the part of the Democrats to try to put sanity into an insane situation. And that's what's happening. And they're trying to convince the American public that in order to make this country right and create jobs, we must take away from the seniors. Right. Well, there's that wisdom that comes with age. We're old enough to know they're full of Congressman Alcee Hastings, Outstanding Leadership Award, Ted Deutch. And with Ted and with Alcee, we don't have to lobby them. That's the true mark of a good legislator that's representing you. When you don't have to explain your issues and beg them to vote for you and what's right. They vote for what's right without being lobbied. And in recognition of that, we have the Outstanding Leadership Award presented to Congressman Ted, who responded with the willingness to work and help us support health care. Now listen carefully. We're going to have a bill introduced in the State House and Senate for a not-for-profit health. Now, am I going to tell you it's going to pass? No, I'm not going to tell you that. I'm not going to tell you it will come out of committee. But what I will tell you is that these good people are willing to put their support behind a bill because it's the right thing to do. Collective round of applause to our state representatives.
Receive the healthcare professionals that they need. This is a great piece of legislation for those who truly need it. So again, I don't want to speak too long, but I will just say this. We as a caucus, a Democratic caucus, will be on the right track. We're up there fighting for you every day in Tallahassee. It's difficult, but you give us the strength. Tony and your group is with us every step of the way. You come up during legislative session, you support us in our initiatives, and let us know we're not alone. Very important. So thank you for watching our backs at home. Thank you for being there for us with the support in Tallahassee. We continue to fight for you.
What the legislature did this year is we passed a huge, what they call Medicaid reform bill. And unfortunately, what this bill does is it takes the $21 billion that the state of Florida pays for Medicaid and privatizes it. Yeah, it's going to be a huge problem.
On the issue of the Medicaid waiver, the Florida Alliance sent a letter to the director at the government level supporting that issue. So we're on top of this, and bless all of you. And bless all of you. Mark Pafford.
Unfortunately, the majority party for the last 12 years in the state of Florida, and now we're seeing it again at the federal level, we've painted ourselves into this financial corner where we're not allowed to be bold and be courageous and add on to the great society that we've built over the last 70 years. But instead, we're stepping back and saying, you know what, there's no room to raise taxes. And we know who those taxes are going to be raised on, right? It's the very wealthy in this country. It's to the point that we are willing to risk our greatest society, everything we've put in place, whether it's Social Security, Medicare, Medicaid, we're willing to risk it all for political victory in 2012. And that shouldn't occur.
And she talked about how great it was that HMOs are going to be handling our Medicaid in the state of Florida. About how they're going to use preventative medicine instead of the backside medicine. Well, they're going to prevent something. They're going to prevent good health care.
How is it that even people with insurance go into hospitals with serious illnesses and come out bankrupt? Managed care crept into the equation, and the more we looked at it, the more we felt that managed care means that the doctors and patients can't manage and the insurance carrier does. And really, at the end of the day, we have to be confident that fear and anger can be put aside so that good sense and a resolution will be achieved. I got my fingers and my toes crossed, and you should too. At the end of the day, let's keep America strong and healthy. Thank you.
I'm supposed to take it home.
Yes!
I am State Representative Mac Bernard, and however, it is very hard for me to stand up here to take credit for some of the works that we did in Tallahassee, but I want to make sure that we give a round of applause to the people who fought in the federal government to get affordable health care. So first of all,
right, concluding the meeting today, we're going to have a song, and then we will all be excused. So.